Hi, so I'm Bill England, Office for the Advancement of Telehealth at HRSA. I'm relatively, as mentioned, new to HRSA, but I've been in telehealth for a very long time. One thing about our office is, compared to my federal colleagues, is we're pretty small in terms of what we fund, but 100% of what we're doing is telehealth. So most of what we're doing is going to have a hard time fitting into evidence, research, but we would very much like to be more in that space. I'm going to talk about all the different programs you're doing, and then let me mention some of the things we might like to do. We're, as all of us are, on a continuing resolution, so I'm a little bit constrained in what I can say we're going to do since we don't have a budget or know what our budget will be. I, in fact, had to take out the slide that shows our total current funding is about $16 million. We would think that might happen next year, but again, I can't put anything in writing that suggests that could happen. If we could, let's see, jump to the next slide. So again, our office funds telehealth. We have 6 different programs in which we do that. This is the Office of Rural Health Policy, of which we are a part. We're one of 4 components there. Some of our other components also can have telehealth in them. That happens as a result of one of our network grants, for example, that may include telehealth in the hospital or community-based division. Telehealth Network Grant Program is our original and biggest program. We currently have 21 grantees in this program. This is the program, and some of you actually are related to grantees. This program is focusing on school-based health clinics this year, or in awards that were made last summer. These are typically 3-year awards. If, and assuming we go out and do that again, we may not focus it on school-based health clinics. We don't know specifically what we might focus it on. We've never focused on a specific component of healthcare delivery in the past. We've simply said telehealth networks, whatever you want to do, but this year we decided to try a specific focus. It seems to have been very well received by the rural health community. I should also mention our grants are specifically to focus on rural or underserved areas. This is our one slight claim to research, but I'm terribly embarrassed that it's terribly out of date. In the information we do collect, one thing we are very good at collecting in our networks is mileage driven by patients to physicians or saved by patients because of telehealth. So this report, which was published in 2013 using our data only through 2010, accounted for 75 million patient miles saved, and we converted that to dollars. We have all the data and are working on updating this for 2011 through 2016. I hope we might get that out this summer. But this is our one opportunity, at least based on old data, to do something that is more than simply funding, but to actually show what telehealth is doing. And here's actually some of the numbers. So we had logged in the first 7 years of our program 365,000 visits that our grantees had covered, 75 million patient miles saved. We translated that to $41 million. But again, I'm embarrassed to say this is pretty out-of-date data, but it's being updated. Our evidence-based telehealth network grant, this is our first real attempt to be scientific about data collection. We unfortunately didn't, due to trying to get this out quickly, we had a few challenges that we'll probably, and we'll talk more about this. Marcia's not in the room, is she? I don't want to steal. We'll have a presentation, I think, tomorrow. They'll talk a little bit about this. We started the grant, and we started the plan for what we wanted to study both at the same time. And that actually, we should have started the plan before we actually started funding the grantees. And I'm sure Dr. Ward is probably going to comment a little on that. So I think HRSA will do a better job the next time we go about doing this. But this is an attempt to really collect scientific information on outcomes and on costs. We expect we will continue this. This is simply a spin-off of our main telehealth network grant program. This one's smaller. What we would love to do, and hopefully we'll do in the future, is we won't have a, quote, evidence-based program and just a program where we just fund networks. There will be one thing, and in all of our grantees, we will be collecting good, solid data. I'm very interested in what this group does. We would love to hear from you what we are doing. One thing to bear in mind with all agencies, but particularly with us, who are not accustomed to being active in the, quote, research telehealth area, is there's a very long lead time in us deciding we want to collect information and being able to collect it due to, as I'm sure you're all aware, Paperwork Reduction Act, the design the study, then get it approved. In this particular program, we also discovered a variety, because we were dealing directly with patient data. We had never done IRB clearances. We didn't even know what that was. So again, this is an area we're just not heavily experienced with, but in the future we probably will be a lot better at it. But as you all have ideas, please feed them to our office. Feed them through our telehealth resource centers, which I think are closely or will be closely integrated in what you all are doing here. So again, those are our two largest programs relative to evidence, to studies. Then we, as I just mentioned, Dr. Ward is here from our telehealth research center. We do have a center that is specifically focused on telehealth research, and our plan was we would collect all this wonderful information to allow her to analyze, and I'd have to say we haven't exactly done that yet, but we hope to get there. But meantime, we have other things we are also able to study. And again, I don't want to, I don't know what your presentation is. I don't mean to steal it. I apologize if I am. Rural Child Poverty, this is a program, again, this is a network grant program. This one's in schools. This is a relatively small program at 4 places where we're simply trying to integrate telehealth and social services in a community to see if we can be more efficient in caring for children. The telehealth resource centers, this is what is the Matrix and our 12 telehealth resource centers, and this is the group that I think will and hopefully will be closely watching the development of this group, very interested in this group. I have to be careful. Kathy, I don't know if you're, for example, helping at all on the funding of this. This kind of work is something we are very interested in. I don't have any specific grants or things that I can do to fund research, but we would be happy if our TRCs are helping you advance this. This is what the kinds of things they certainly are interested in, and we are certainly interested in funding them to advance telehealth, and this is part of it. Then our, more about the telehealth resource centers. Our veterans program, this one's unique. I spent 2 days last week meeting with the VA. We have a lot in common with the Office of Rural Health in the VA, which has a huge telehealth program. We know not a huge amount about it, but this is our connection to them. I think we'll be working more with the VA. There may be some interesting opportunities. And the VA, of course, does tons, billions of dollars of telehealth. So there may be some opportunities to partner a little more with the VA through our grant program that connects us to them. License portability, we're also funding a research. The FSMB model that's been referenced in the last couple of days here is something that we're working on. This is just more, this is actually a graph of license portability on the nursing compact, comparing it to the FSMB for physicians. Then the last piece, we do coordinate a group of all federal agencies, and actually, I was taking down so many names. I think we have about 100 federal employees listed on this group, about 25 federal agencies. So as you come up with ideas, this is unfortunately not a group I can invite you all to because it's only for federal employees due to notice, public notice, et cetera. But we do have a contact through this with anyone in the federal space doing telehealth. If there are ideas that you have that you would like to get the message to all federal agencies, this is a vehicle that we can be more than happy to help you with that. And I'm going to invite a few of my new NIH the names that were up there to join this. And then also in our operating components, community health centers are collecting lots of data, which is public information that we're going to start analyzing. They're moving into the telehealth space. The FCC, where I recently came from, has lots of information that they are putting up on location of broadband and how it affects telehealth. And then the Find It telehealth provider that actually, if you were here this morning, Kathy mentioned. And I think, how to apply for HRSA grants, grants.gov, same as NIH. And we also are always looking for good reviewers for our grants. We need people that are not applying for the grants that can help us review them. So that's our staff. So I think we would take questions afterwards, or? Yeah. Yeah.